include seniors, would it also fire it, or would seniors, females and
I think, so I'm sorry, I'll just repeat the question. I think the question is, in our studies, did we include seniors?
Yeah.
So which study are you talking about? All the studies?
Yeah.
So it depends on the study. So for the data that I showed you about mortality, it includes people all the way up to age 75. Although obviously, you can see that there are very few people who make it to age 75, but we include elderly people in the studies. And it's the same with the healthcare utilization data, that includes older people, but they make up a relatively small group of the population. Does that answer your question?
Yes.
Well, once again, let's thank you very much to Dr. Stephen Lang, please. That's some great information there. It's important that these studies are done so that we can get our facts correct and know what we can go to council with knowledge and information and just become better people and better communities around the globe. Next we have a special speaker from UBC Associate Member, General Internal Medicine, Dr. Anita Palepu. I hope I said that correctly. Come on up, Anita.
So thank you for having me here. I'm really happy to speak to everybody. And I don't want to take up too much time because we have so many great speakers today. So what I wanted to present was a health and housing and transition study, and that's a study that we've been doing in Vancouver, Ottawa, and in Toronto. And a lot of you here who are working for various organizations and in the shelter system have helped us a lot to make this study happen. So I'd like to just acknowledge the CIHR is funding the study, the HIT study team in Vancouver. Liz Evans has been helpful. One of my collaborators here couldn't be present, Anita Hubley, Stephen Wong, and Tim Aubrey. Tim is in charge in Ottawa, and Stephen's doing the study in Toronto. So I have no conflicts of interest. And the objective, I just wanted to present some preliminary data on the study. And it is a longitudinal study where we're following people over time who are both homeless and vulnerably housed. And we started the study in 2009, and we have 2 years of follow-up, and it's ending in 2012. And what I also wanted to describe that may be of interest particularly to this audience is some of the transitions of people who are in the SRO housing stock and how that played out in at least 1.5 years of follow-up. So everyone here has a clear conception of who the homeless are, but I think in the general population, often people think it's a state, or it's more like a trait, I should say, that you are a homeless person, when in fact people are often transitioning to various situations in their life, and it's really more of a state. People come in and out of homelessness, and there is a quarter of people who are what we would describe as chronically homeless for extended periods of time. And this is a slide that trying to show that the two vectors are two determinants of health. So maybe we could say in this homelessness, what are some determinants? We could map it out as addiction may contribute to it, or mental illness. And they can be very different characteristics. Some people could have schizophrenia and they're using substances to drown out voices that they're hearing. Other people could have been using other drugs recreationally and then have a lot of consequences that they didn't anticipate from them. And then they have a hard time getting back into the housing market and then develop a secondary major mental illness like an affective disorder. So I guess what I wanted to highlight is the pathway to homelessness is often very complex, as all of you know, and there needs to have different targeted interventions to deal with them because not everybody's in the same situation. As I mentioned earlier, homelessness is often an episodic experience rather than a chronic state. And we characterize vulnerably housed as people who are low income, often socially marginalized, and living in SROs or rooming houses throughout this country. And the Canadian Mortgage and Housing Corporation defined it as spending more than 30% of their before-tax income on housing. And frequently there are transitions, and we were interested in what are the resources people have and the risk factors that influence these transitions. And everyone here knows in Vancouver, it's pretty much impossible to afford a market rate bachelor apartment if you're on welfare or disability as a single adult. There's very long wait lists for social and supportive housing. And for many people, SROs are the only option in Vancouver, and the quality is highly variable. There's some amazing places where there's incredible supports for people, but there's others where the living conditions, I think, are very difficult. In 2007, the data suggests there's about 136 SROs. This probably needs to be updated, and providing accommodation for 7,000 people. So our study, what we wanted to look at was what are the incidents of transitions between the housing states, so being vulnerably housed and homeless, how much are people moving throughout these states, and we wanted to look at risk factors and resources that are individual, interpersonal, and community-based in terms of attaining housing and also losing their housing. And we wanted to look at whether or not these changes in housing were actually associated with changes in their physical and mental health and other major health determinants. So our target population were single adults greater than 18 years old, and we defined people who were homeless if they were in the shelter system or they were not in the shelter system, so sleeping outside, and we recruited those people largely from meal programs. And the vulnerably housed in Vancouver were in the single room occupancy hotels, and in Ontario they were the rooming houses because that's their low-income housing stock. And if we had a vulnerably housed person, so they were in the SRO system, and they had to have moved at least twice in the past year, because there are people who are actually very stably housed in the SRO system and have lived there for a long time, and they also had to be spending more than 30% on rent, which is by definition given our income assistance. So we recruited 200 people in each city who were homeless and 200 people in each city who were vulnerably housed, and our target was 1,200 people. So we had a questionnaire which we piloted and revised. It was the interviewer administered them with the participant. It took 75 to 90 minutes. Sometimes it took longer. We had informed consent, and each person received a $20 honorarium. We collected information on their housing history, their self-reported health status, chronic physical health conditions, mental health conditions, substance use, addiction treatment, quality of life, their social supports, their community services. And we actually asked some questions around the Olympics because we had this window of opportunity to have some questions to see what was the impact of the Olympics or how they perceived it in terms of a mega event. So who were the people that we interviewed? So their average age was 42 years old, and we did have people who were older, 72 and as young as 19. 17% identified themselves as First Nations in the whole group, but actually in Vancouver it was higher, about 28%. 58% were single, never married or partnered. 26% were divorced or separated. 45% had less than a high school education. And the lifetime duration of homelessness on average was about 3 years. And among the homeless at baseline interview, 90% had moved at least 6 times in the previous year. So when I say median, it means 50% of them had moved 3 times. And among the vulnerably housed at the baseline interview, 90% had moved 5 times in the previous year. So what I just wanted to highlight is that the people who are from the SRO, the vulnerably housed, and the actually homeless people, they're very similar in terms of their transition. So they're not very different that way. So the big picture of what we found is that people who were vulnerably housed had the same severe health problems as people who were homeless. They had serious physical and mental health problems. They had problems accessing the health care that they needed. They experienced a lot of hospitalization. They experienced assaults, and a lot of them said that they felt they were hungry. In terms of health status, both homeless and vulnerably housed had poor self-reported health status in terms of, this is a scale we use, and the physical component score represents how they report their physical health, and it was 44, and mental health was about 39, and the average population is 50, so it's lower, and the mental health was significantly lower. Some of the chronic health conditions, so remember, these people are on average 42 years old. And look at how many chronic health conditions people are reporting. 18% have high blood pressure, 10% have heart disease, lung disease with emphysema, chronic bronchitis, hepatitis B and C, 33%, HIV, 11%. It's higher in Vancouver. This is the whole study. Pneumonia. People have a lot of comorbidities. Liver disease, 7% actually having